Hello everyone. Welcome back to another episode of Code Web Training. Today we are excited to launch our training series on ICD-11, an important milestone in how we classify and report health and disease worldwide. Today we kick off with an introduction to ICD-11. ICD-11 represents a modern evidence-based framework designed to capture more nuanced clinical concepts, support better patient care, improve public health surveillance, and enable richer data for research and policy decisions. It reflects advances in medicine, digital health, and international collaboration, while remaining rooted in the familiar structure of ICD that you have relied on for years. Over the course of this session and the series to come, we will dive deeper into other features, resources, and tools of ICD-11. Code Web Training is a foundational introductory resource to help you become familiar with ICD-11 concepts and terminology. It is not a substitute for a comprehensive formal ICD-11 training program. For full proficiency and certification, please pursue an in-depth in-person or formally structured course delivered by recognized ICD-11 training providers. While we introduce ICD-11, ICD-10 remains in active use for many programs during the transition. To support you fully, our CWT program will continue to cover ICD-10 topics in upcoming sessions, ensuring you stay proficient across both coding systems. Thank you for joining this important journey. Together, we will unlock the power of ICD-11 to improve mortality reporting, support better patient outcomes, and strengthen health data worldwide. Let's begin with a high-level tour of what's new, what says familiar, and how this transition will unfold in your daily coding practice. My name is Saman Gamage, and I am a medical doctor with a specialization in public health. I currently serve as a senior technical advisor on medical certification and ICD within the Bloomberg Data for Health initiative of the CDC Foundation. And I will be your guide through this presentation along with other experts, Patricia Wood and Yusuf Hamad. Here is the outline of my presentation. I will first talk about what is ICD, history of ICD, WHO family of international classifications, multiple uses of ICD, structure and taxonomy of ICD-11, ICD-11 tools and resources. What is ICD-11? ICD stands for International Statistical Classification for Morbidity and Mortality Statistics. Now in its 11th revision, ICD is managed by World Health Organization, and ICD is used by all the UN member states, and many countries are in various stages of implementation of ICD-11. ICD is used to translate diagnosis of diseases, causes of deaths from word into alphanumeric codes. Alphanumeric in the sense ICD codes comprise of alpha characters, English letters, and Arabic numbers. This process of translation is called clinical coding because we translate clinical concepts. The person who does coding is called coder, and coders need training and experience. I would say they need thorough training and experience. Let's discuss some of the historical aspects of ICD. The theory of disease classification began in the 17th century when John Grant analyzed the data on the bills of mortality, the official records kept by parish clerks. The first statistical study of disease, natural and political observations made upon the bills of mortality, was published by John Graunt in 1662 in London. Another prominent name in the history of ICD is William Farr, who was a British epidemiologist, and he is regarded as one of the founders of medical statistics. In 1891, the International Statistical Institute charged a committee chaired by Jacques Bertillon with the preparation of the classification of causes of death. Bertillon's classification received general approval and adopted by several countries. It was suggested that classification should be revised every 10 years. Revisions were done under Bertillon's leadership in 1900, 1910, and 1920. After Bertillon, the fourth revision was done in 1929, the fifth revision in 1938 in Paris, the sixth revision was done in 1948 under the WHO's leadership. The sixth revision is one of the turning points of ICD because prior to sixth revision, ICD was used only to classify causes of deaths. However, from the sixth revision, they identified the potential of ICD for classification of non-fatal conditions. Therefore, non-fatal conditions were included in the classification. Because of that, the number of categories started to increase. The seventh revision was done in Paris in 1955 with very few changes. The eighth revision was done in Geneva in 1965, which was more radical than the seventh revision. The ninth revision was done in Geneva in 1975, and with the ninth revision, 4-digit and optional 5-digit subdivisions were introduced. Development of ICD-10 began in 1983 with an international meeting in Geneva. The concept of family of classifications was introduced with the 10th revision of ICD. The reason is they understood that all user needs cannot be encompassed in a single classification. Because of the advancement of medicine, different specialties came up. There are multiple users and they have different needs and they cannot encompass all user needs in a single classification. Therefore, the family of classifications was developed with ICD-10 as its core. This is the family of international classifications during ICD-10. Within this family, there are reference classifications. They're like parents in a family. And then in a family, there are children. The derived classifications are like children. So there are derived classifications for oncology, for mental and behavioral disorders, for dental stomatology, dental adaptation, and then there's a neurological adaptation. So those are derivations of reference classifications. And there are also related classifications like ICPC, International Classification of Primary Care, International Classification of External Causes of Injury, and so on. In April 2007, WHO announced the beginning of work to create ICD-11. For the first time, WHO invited stakeholders to participate in the ICD revision through an internet platform. This update was vital in order to keep up with recent progress in medicine, the use of information technology in the field of health, and to improve the basis for international comparisons. As we have discussed now, The evolution of ICD is shown in this graph from ICD-1 to ICD-11. And ICD-11 was introduced in 2018 after using ICD-10 for 28 years. So ICD-10, with ICD-10, they started using alpha characters in ICD codes. Therefore, there was some room for expansion and revision. And this is the reason why we have been able to use ICD-10 for 28 years, even more than that. With ICD-11, the usability is very much improved. There is integration of classification and medical terminology, and it is easily add all clinical detail, including acronyms. It's a fully digital computer-assisted coding with ICD-11 coding tool and improved incorporation into electronic environments. Linkage to relevant other classifications and terminologies. The ICD-11 has been designed to address the needs of a broad range of use cases. Can be used in mortality, in morbidity, epidemiology, case mix, quality and safety, primary care, and so on. So ICD coding we use for morbidity use case and mortality use case. Morbidity use case, we can code patient care episodes. So it can be used to code illnesses, injuries, screening, preventive care, and reasons for contact with health services. Mortality use case, we use ICD for underlying and multiple cause coding. Death certificates are the main source of information for mortality statistical data. The cause of death information in death certificates is coded by mortality coders. Mortality coding is a complex process of applying mortality coding rules until you select the final underlying cause of death. Coders need thorough training and experience in applying rules and selecting the underlying cause of death. This chart shows you the application of ICD mortality coding rules. There are 12 different rules, SP rules, SP1 to SP8 and M1 to M4. And the correct application of these mortality coding rules will result in the selection of final underlying cause of death. WHO FIC provides standardized building blocks for health information systems. There are reference classifications, there are derived classifications, and there are related classifications. The reference and derived classifications are based on the foundation component. So this is the WHO structure of WHO FIC with ICD-11, with the introduction of ICD-11. In ICD-11, the reference and the derived classifications are based on the foundation component, which is a large collection of concepts with synonyms and preferred terms and their relationships, which describe health and health-related domains. Terms and entities related to diseases and health-related problems are organized into the ICD. Those pertaining to functioning into the ICF, and those related to interventions into ICHI, International Classification of Health Interventions. Terms from the foundation component may be used in more than one reference classification. Derived classifications draw on terms that may come from one or more of the reference classifications. Within the WHO FIC family, related classifications are regarded as complementary to the reference and derived classifications. Related classifications have their own sets of terms, but can also share terms as part of the WHO FIC family. The purpose of the WHFIC is to assist the development of reliable statistical and other data systems at local, national, and international levels with the aim of improving health status and healthcare. ICD-11 is currently available in 14 languages, including Arabic, Chinese, Czech, French, Kazakh, Latin, Portuguese, Russian, Slovak, Spanish, Swedish, Turkish, and Uzbek, and more language versions are underway. The comparability of translations is improved. This means the same disease documented in different languages will result in the same ICD-11 code. ICD-11, ICF, and ICHI entities are understood in the same way everywhere. That is, full conceptual equivalency and cross-cultural compatibility. Because of that, WHO FIC provides true semantic interoperability and comparability of health data. Here is an example for comparability. Acute pancreatitis in English coded to DC31.Z. In French, it is also coded to the same code, and if you use it in Russian, the same code will be resulting. And it is a multilingual platform. As I said before, translated into 14 languages and 17 more translations are underway. If you compare ICD-10 with ICD-11, ICD-10 has nearly 14,000 statistical categories. That means codes. And then you have to use a separate text index. Volumes are printed volumes. An online version is available, but for coding, you will have to use the printed volumes or PDF versions, and there is room for expansion and revision. However, ICD-11 is a clinical system for statistical use, which has 17,000 statistical categories. That means codes, 80,000 entities, 135,000 terms, and 2.5 million terms with formalized post coordination. It is searchable in Google style with very minimal training. So it has ontology with multiple parenting. All desired clinical details are codable, and we can use code combinations and more details beyond statistical categories. The foundation in the foundation. As you can see in this chart, there are blue dots. Blue dots are the categories or entities with ICD codes, ICD-11 codes. But within the foundation, there are other statistical categories, even though they do not have ICD-11 codes, they have unique resource identifiers because it's a codes and URI combinations. So even though it doesn't have a specific ICD-11 code, it has a unique resource identifier. So we will talk about these definitions in upcoming future sessions. For example, the definitions of URI, the entity title, code, category, and index term will be discussed in future videos and future coded training sessions. So ICD can be used for diagnosis, injuries, signs, symptoms, findings, reasons for encounter or health status, external causes. Then it can also be used in traditional medicine conditions and the newly added functioning assessment called the WHO Disability Assessment Schedule. And through extension codes, we can go into more details for severity, temporality, anatomy, laterality, consciousness, infectious agents, and so on. ICD-11 contents The contents of the classification have been greatly enhanced in ICD-11. Compared to ICD-10, there is increased clinically important content. I can show you some content enhancement examples. HIV stages. Then there is new definition of sepsis. The course must be coded first. So if you code for sepsis, you can always code for the causing condition. Then subtypes of melanoma and added basallioma. Tumors with histopathology regroup in brain and blood tumors. Then there's a new structure for pulmonary hypertension. Male infertility, there are different types of male infertility. Land transport accidents, high level, now traffic and non-traffic land transport accidents. Can go into more and more details. And also embedded WHO Disability Assessment Schedule, WDAS. Therefore, there are multiple uses of ICD. It can be used for cause of death, prevention, injury research, cancer registration, case mix costing, resources and DRGs, primary care, in research, patient safety, device safety, drug safety, functioning assessment, and for clinical terms. So there are multiple uses of ICD-11. When you use ICD, you can use ICD-11 in a web-based setting, or you can use ICD-11 in an API-based setting. And also, ICD-11 is also available as an analog paper-based setting. In a digital web-based setting, you can access ICD-11 through a web browser. So you can code diagnosis in health records or death certificates or other places. And you can use the browser or coding tool and look up codes manually. No need to automate code lookups or integrate with systems. So this is direct access and using ICD-11 coding tool or ICD-11 browser through a web browser. And then ICD-11 can also be used in an API-based setting. ICD-11 is accessed programmatically via API and returns structured data suitable for integration into software systems and automation friendly for bulk lookups and batch processing. The IT Guide to ICD provides more details on compatibility requirements for API. ICD-11 is also available as an analog paper-based setting and is available for training purposes. This is particularly available for training purposes, a tabular list, reference guide, and an index. However, paper-based systems may cause some problems. There can be issues of readability, timeliness, and computer-assisted plausibility checks are not possible with analog paper-based volumes. And ICD-11 should not be used in an analog setting. It's very important that the online or offline version of ICD-11 coding tool can and should be used along with analog paper-based setting. So when you want to download printable versions, you can do it through the ICD-11 homepage. Let's discuss about the structure and taxonomy. The ICD's chapter and block structure have evolved over 150 years in 11 iterations of classifications. The evolution of the ICD carefully balances the need for categories that match current knowledge and statistical comparability over space and time. The ICD is a variable axis classification. The structure has been developed as proposed by William Farr. The epidemic diseases, constitutional or general diseases, local diseases arranged by site, developmental diseases, injuries. These groups remain in the chapters of ICD-11. Let's go through the ICD-11 chapters. ICD-10 has 22 chapters and uses all 26 letters in the codes at the first character position. Whereas ICD-11 comprises 26 chapters. The chapter numbering is in Arabic numbers and not in Roman numerals as in ICD-10. Chapters 1 to 9 in ICD-11, the chapters 1 to 9, the first character of the codes is the chapter number. Chapters 10 to 26, the first character of the codes is an English letter from A to S except I and O. The letter I and O are omitted to avoid confusions with 1 and 0. Letter X is the first character in extension codes. Here are the chapters, chapter 1, 2, 3, 4, 5. And chapter 4 is a new addition, diseases of the immune system. There was no such chapter in ICD-10. Then we have chapter 6, 7. 7 is a new addition, sleep-wake disorders. Then chapter 11, 12, 13, 14, and 15, similar to ICD-10. And then we have chapter 17, conditions related to sexual health, which is also a new addition. Then we have chapter 26, supplementary chapter, traditional medicine conditions, module 1. Then supplementary section for function in assessment. And then we have extension codes, which is also a new addition to ICD-11. So ICD-11 has 26 chapters, while ICD-10 has only 22 chapters. So ICD-11 chapters, there are 26 chapters. The first character from chapters 1 to 9 is the chapter number. Then from 10 to 26, it is an alpha character from A to S, except I and O. X is the character for first character in extension codes. And as I told you before, I and O, the two letters have been removed to avoid any confusions with the numbers 1 and 0. So here are the new chapters. ICD-10 chapter 3, diseases of the blood and blood-forming organs and certain disorders involving the immune system, immune mechanism. So it is divided into two chapters, ICD-11 chapter 3, diseases of blood or blood-forming organs, and the diseases of the immune system comes in chapter 4. So we had chapter 5, mental and behavioral disorders in ICD-10. However, in ICD-11, chapter 6 is mental, behavioral, or neurodevelopmental disorders. And in chapter 7, you will find sleep-wake disorders. Chapter 14, diseases of the genitourinary system, is divided into two. ICD-11, chapter 16, diseases of the genitourinary system. However, the conditions related to sexual health comes under chapter 17. And then there are extension codes. The first character is X. Then there are other codes reserved for other specified categories. The last character is Y. And then there are some other categories reserved for residual category, unspecified. The last character is Z. These codes and these characters will be discussed in upcoming Coder Web training sessions. Talking more about the code structure, ICD-10 code structure. Codes are alphanumeric. That means alpha characters and Arabic numbers. Range from A00 to Z99. The coding scheme for categories is minimum 3 characters, maximum 5 characters, that is 2 levels of subcategories. Always a letter in the first position. The letter U was not used originally, subsequently assigned for codes for special purposes. Under Chapter 22, for example, the codes for COVID-19, codes for SARS. So here is an example code, U07.1, which is the code for laboratory confirmed COVID-19. And then in ICD-11, there's a new addition, new feature, uniform resource identifiers. For any condition, any entity, there is a uniform or unique resource identifier, commonly known as URI, which is a string of characters that uniquely identifies a particular ICD-11 entity. Each entity has a specific place in the hierarchy of groups and categories. And unique resource identifier or URI will not change with the updates to ICD-11, and it will be the same. Talking about ICD-11 code structure, codes are alphanumeric, range from 1A00.00 to ZZ9Z.ZZ, minimum 4 characters and maximum 6 characters. That means 2 levels of subcategories. Always a letter in the second position to distinguish from codes of ICD-10. Because ICD-10 has a letter in the first position, in ICD-11 code, there is always a letter in the second position. Then you will know this is not an ICD-10 code, this is an ICD-11 code. The letters O and I, as I told you before, are omitted to prevent confusion with numbers 0 and 1. Talking more about ICD-11 code structure, the first character of the code always relates to the chapter number 1 to S. A number introduced at the third character prevents spelling undesirable words. For example, BA50, old myocardial infarction. So this is a number at the third character position, and that prevents 2 letters, 3 letters coming together, pronouncing some undesirable words. So this is the code structure. The first character is the chapter indicator. The second character is essentially a letter, alpha character, to differentiate from ICD-10. And third character is essentially a number to avoid undesirable word spelling or pronunciation. There are different ICD-11 code types. There are stem codes. Then there is a concept called pre-coordination. There are extension codes. Then there is a concept called post-coordination. And then there is another concept called cluster coding. So these concepts and code types will be discussed in future Coder Web training sessions and in future videos. If you open the WHO ICD-11 home page, this is what you will see. And from the home page, you can access various ICD-11 tools and resources. As you all can see, you can access the browser, coding tool, API, then implementation or transition guide, then the reference guide, which is equivalent to chapter 2, volume 2 of ICD 10, ICD 11 fact sheet, license, and there is a training and video. And also, if you want to access the ICD 10 browser, there is a link provided from the home page to access ICD 10 browser. And there is also a maintenance platform, which I will talk about in other sessions, in future sessions. So browser is an important, useful tool. I will briefly introduce browser, but I will not go into the details during this video or during this presentation because there will be a separate Coder Web training on ICD 11 browser to discuss ICD 11 coding tool, and we will talk about maintenance platform, and then the ICD API, application programming interface. And a new addition to ICD 11 is the Doris, which is the automated tool for mortality coding, which we will discuss in the future sessions. So this is ICD 11 browser. So you can use browser to see the content. You can either search for a disease or you can search for a code. So browser is used to see the content. The tool allows coder to search courses using text-based terms and identify all possible course categories available. You can also use ICD 11 codes for search. ICD 11 coding tool looks like this. It's simply the Google style search. You can just type in what you want to search and you will get the result instantaneously. And we will learn more about the browser and coding tool in future Coder Web training sessions. And there is also an opportunity to be involved with the maintenance of ICD 11 or development of ICD 11. So there are various ways to contribute. You can comment, you can submit proposals, and you can work on translations. So this facility is made available through the maintenance platform. This is how it looks like, the maintenance platform. Once you have created an account, you can log in and you can submit proposals. And the proposal mechanism allows public to suggest changes in the classification or enhance the contents in it. So anyone can access and suggest changes or submit proposals. So these are the released versions so far. The initial release was in 2018. The latest release was released in 2025 January and now available in 14 languages. So in the 2025 January version, there are 843 updates in main codes and there are 32 updates in extension codes. So every year in January or February, we can expect a new version of ICD 11. And it's a digital platform. So you don't have to buy new books as you did for ICD 10. No printed volumes. It's a digital platform. So it's easy for updating purposes. So thank you very much for listening to my video. And the live presentation will be on the 28th of January. And on the 29th of January, it will be available for the Caribbean islands. So we'll meet you again in a future Coder Web training session. Thank you very much.